Thank you all so much for joining us today for Financing Early Educator Preparation, Support, and Compensation, a conversation about state action steps. This webinar is hosted by the Early Child Workforce Development Research Alliance. At this time, I would like to introduce Dr. Kyle DeMeo-Cook, who will kick off today's webinar. Good afternoon, Kyle, and have a great session.
Thank you, Shanna, and welcome to today's webinar, Financing Early Education Preparation, Support, and Compensation, a conversation about state action steps. I'm Kyle DeMeo-Cook, a Senior Research Associate at Education Development Center, and the lead researcher for our Early Childhood Workforce Development Research Alliance for the Regional Educational Laboratory, Northeast Islands, which is the host of today's webinar. We are thrilled to have so many people joining us today. The Early Childhood Workforce Development Research Alliance is a group of early childhood leaders across the region who are focused on using research and evidence to refine programs and policies aimed at increasing degree attainment, credentials, compensation, and professional development for the early childhood workforce. During today's webinar, we will hear from national experts and members of the Workforce Development Research Alliance. After this brief welcome and introductions, we will have a presentation on the findings from the National Academies of Science report, Transforming the Financing of Early Care and Education, focusing on the findings specifically related to financing early educator preparation, support, and compensation. Then we will have a facilitated conversation between a report author and one of our states to dig deeper into the recommendations on state action steps. I'm thrilled to be joined today by a stellar group of moderators and panelists. Lynn Karoly is Senior Economist at RAND Corporation. She is an author of the report we will be discussing today and will provide presentation of the findings. Sherry Cleary and Ola Friday are members of our Early Childhood Workforce Development Research Alliance and have been instrumental in designing and planning of today's webinar. Ola is Associate Commissioner of Workforce Development for the Massachusetts Department of Early Education and Care, and she will provide us with a perspective from one of our states. Sherry Cleary, Executive Director of the New York Early Childhood Professional Development Alliance, will serve as today's moderator. I will introduce Sherry, who will then further introduce Lynn and Ola. Sherry is the Executive Director of the New York Early Childhood Professional Development Institute. The Institute is a unique public-private partnership that brings together city and state agencies, a consortium of private funders, and the nation's largest urban university to create a center that coordinates the establishment of a workforce system to ensure funding, standards and competencies, career development resources, qualifications and credentials, training and quality assurance for individuals who work with young children throughout New York. Sherry also co-chairs the Governor's Early Childhood Advisory Council for the state. Prior to return to New York, Sherry was at the University of Pittsburgh, where she was the director of the University Child Development Center, the founder and executive director of the University of Pittsburgh Institute for Excellence in Early Childhood Education, and a faculty member in the School of Education. Sherry began her career as a pre-K teacher. Sherry is an active member of our alliance and has played a key role in planning of today's event. I will turn the webinar over to Sherry now as the moderator, and she will give you a brief overview of the goals for today. Welcome, Sherry.
Thank you so much, Kyle. Great. So today's goals, we want to learn about these recommendations from the report, Transforming the Financing of Early Care and Education. The report really focuses on early educator prep, support, and compensation, and really follows the initial report called Transforming the Workforce for Children Birth through Age 8. If you've not had a chance to take a look at the first report, you'll want to do that as well as really digest the second report. Today we're going to ask specific questions about actionable steps states can take to build their own systems to support the workforce, and we'll consider what research is needed to support states in their efforts to develop sustainable finance structures for high-quality early education. I promise that we'll leave time for questions at the end, and we already have some questions that people have posed when they registered, and so we'll try to get to as many of those at the end of towards the end of the webinar. So the next thing we'd like to do is just ask you all a simple question, and that is, are you familiar with the findings from the Transforming the Financing of Early Care and Education report? And so I'm going to launch this poll. Somebody wonderful on the line is going to help with this. There you go. And I'm just going to ask those of you that are present today to answer the question. So please vote. Almost everyone has responded. It's fascinating that we're almost at 50-50. So if just a few more of you Okay, I think we can move on ahead. This is pretty helpful to those of us that are on this webinar. So thank you very much for telling us that about half of you are familiar and half of you are not. That's great news because Lynn Karoly has been so gracious to join us, and she's going to really give you a pretty thorough overview of this study, this set of findings. So let me introduce Lynn at the moment. Dr. Lynn Karoly is a RAND senior economist whose research is focused on the well-being of children, youth, and families, human capital investments from birth to adulthood, economic disparities, social welfare policy, and labor market behavior. Much of her recent research has focused on early care and education programs with studies on the use and quality of these programs, the system of publicly subsidized early childhood programs, professional development for the early childhood workforce, quality rating and improvement systems, and early childhood program cost and financing. Another area of her expertise is the application of benefit cost analysis and related tools such as cost analysis and cost effectiveness analysis to social programs, with recent analyses of the economic returns to early childhood interventions and youth development programs. Lynn was a member of the National Academies of Sciences Committee on Financing Early Care and Education with a Highly Qualified Workforce, and previously served on the National Academy of Sciences Committee that produced Advancing the Power of Economic Evidence to Inform Investments in Children, Youth, and Families, as well as the report that we'll focus on today. Lynn received her PhD in economics from Yale University, and I think you would all agree that she's the perfect person to talk to us about the report that we're about to go a little bit deeper into. So welcome, Lynn. Thanks so much for being with us.
Thank you, Sherry, for that very kind introduction. And it's my pleasure to join you all today as part of this webinar. The poll is very helpful for me in understanding that a good portion of you are going to be very familiar with this report. Many of you may already have heard other webinars talking about the report's approach and findings, but I can also see from the poll that this will be somewhat new for others of you. So I do want to take some time to go through the report, but to do so with a particular focus on today's topic, which is the implications of the National Academy study for the workforce itself. And you'll get a flavor for the report overall, but I will be zeroing in on those aspects of the report that are particularly relevant for today's discussion. I do want to briefly note that the National Academy study was sponsored by a variety of public and private organizations, and I think this is a testament to the fact that these issues around the financing of our early care and education system, and one that supports a high-quality, well-compensated workforce, is of great interest across a broad variety of stakeholders. And given the nature of this challenging topic, you can see on this slide that we had broad representation on our committee across both those of us coming with academic background from a variety of perspectives, as well as those who've been involved in leadership in the early childhood field, both at the policy level and at the level of practitioners. So it was a great team to work with to address this issue, identify the challenges, and ultimately a set of recommendations that are part of the report's conclusions. I also want to acknowledge that this report would not have been possible without the support of staff and consultants at the National Academies. So I just want to note that at the outset, when you conduct one of these National Academies consensus studies, you're given a specific statement of task as to what the objective is for the study committee in undertaking a particular topic. And I think what's important to understand in this context is that our statement of task focused specifically on funding early care and education for children from birth to kindergarten, so birth to school entry. We often refer to that as the population of children from birth to age 5, and a system for early care and education that would be accessible and affordable to families, as well as one that would be high quality, one that supported a well-qualified and adequately supported workforce. And all of this task referenced the prior report, National Academies report, called Transforming the Workforce for Children Birth Through Age 8, Unifying Foundation. Although that prior report went through age 8, our task was a little bit more narrowly focused on the system from birth to age 5, partly because of our financing mechanisms currently differentiate between school age and a separate financing system starting in kindergarten from what we have presently for birth to age 5. But that meant drawing on the vision that was in the Transforming the Workforce report. So that was really our starting point, which had a vision for early care and education supported by a workforce that is drawing on the foundation of the science of child development and early learning, one that would draw on our shared knowledge of the competencies required to be effective in working with young children, and the understanding of the supports required to ensure quality in professional practice at the individual system and policy level. So as Sherry mentioned, it's extremely relevant to be familiar with the prior Transforming report before delving into this particular study focused on the financing of that system. The report has a number of key messages that you can see here on this slide. Many of these would be well understood by those of you on the call, but I do want to focus particularly on the second bullet point, which is a set of conclusions that we drew from reviewing the current state of affairs with respect to early care and education for children from birth to age 5, which ultimately is that the financing structure in the current system is inadequate, both to support the recruitment and retention of a highly qualified workforce and to ensure that providers have the incentives to deliver high quality across settings in our approach now that provides for both mixed delivery with private providers, with public providers. And in addition, the current financing structure is not adequate to support access on the part of families to high quality programs. So the focus is, as I'll be talking today, primarily about the aspects of the system that are inadequate with respect to the workforce and ways to address those inadequacies. Our study was guided by a set of principles for a high-quality early care and education that the committee developed. There are 6 principles in total, and each of these are principles related to what is required to deliver high-quality early care and education. And you can see that they range from aspects of supporting the workforce to ensuring equitable access on the part of families, the financing component, the delivery options available, the need for high-quality facilities, as well as larger system support to ensure accountability. And again, for today's discussion, I will particularly be drawing on the principles around the need for a diverse, competent, effective, well-compensated, and professionally supported workforce across the various roles of ECE professionals. So that means not only those who are working directly with children in classrooms or in home-based settings, but also for leaders in early care and education programs, such as program directors or professionals associated with aspects such as curriculum development. In addition, another major focus that I'll be talking about today is the financing aspects of what's required for high-quality early care and education. So that means having a system that's adequate, equitable, and sustainable, with incentives on the part of providers to deliver quality and to have adequate reimbursement for ensuring quality, and a system from the perspective of families that's easy to navigate and to administer, and one that is transparent. And I'll just say a few words about that first principle. We use these principles to look at the current system to see how well the current system was meeting those principles, and with respect to support through financing of a highly qualified workforce, there are a number of deficiencies of the current system that we identified. They include the fact that overall it's well documented that compensation for early care and education practitioners is well below the level that would be consistent with our expectations for their competencies and skills, credentials, and education. In addition, that the financing mechanisms currently available, particularly to support a high-quality workforce, tend to be temporary, and when they do exist, they are not sufficient to provide the kind of predictable and steady support, for example, for compensation, salaries, and benefits that allow for the recruitment and retention of that highly qualified workforce that we know is so critical to ensure high-quality program delivery. And a third drawback of the current system is that we do have financial supports for things like ongoing professional learning, professional development, as well as advancement in education. Those kinds of financial supports are generally provided on a limited basis that does not reach all of the workforce members who could potentially benefit, or they're time limited. They may be supported for a certain time, but then they're not sustained in a way that ensure that they support the workforce on an ongoing basis. One of the components of the study that I just want to briefly highlight was to estimate the cost of a high-quality early care and education system. The reason for doing so is to understand, by understanding the cost, we can then look at how would you pay for the cost of that system. And in looking at the cost, I think the most important thing to keep in mind is that our cost estimates specifically were based upon having a system that delivered high-quality early care and education with a well-qualified workforce and one that was adequately compensated and supported in their roles as early educators. So, for example, in accounting for the cost on-site of an early care and education program, whether that was in a center-based setting or a family child care setting, we assumed that there would be lead educators with a bachelor's degree with compensation that was consistent with that degree of education. We assumed that the kinds of supports in the setting where the early educators worked would support, for example, coaching and mentoring, as well as paid release time for other ongoing professional development. We assumed that these providers would have specialists who would support children with special needs, as well as providing paid time for ECE professionals outside of their contact time directly with children. So that would mean opportunities during the day for reflection, for planning, for meeting with parents in ways that go beyond what educators do in their direct child interactions. We also accounted for the fact that you need to support the workforce at the system level. So that means support for the current workforce in terms of their professional development, but also supporting the incoming workforce with the types of education and opportunities they have for their professional development. As well as at the system level, we accounted for factors such as a quality assurance and improvement system that would address those needs with adequate financing as well. So with that in mind, I will just briefly point to conclusions from this analysis of the cost of the system, and more detail is available in the report itself. But I think a main takeaway is that we estimated that the cost, the total cost, both at the provider level and at the system level, after phasing in improvements in quality and supports for the workforce over time, so that final phased 4 number, is about $140 billion on an annual basis measured in 2016 dollars. And our estimates allowed for delivery of early care and education across the birth to age 5 from both center-based providers and home-based providers. And you can see our estimate of the cost that would be associated with the 2 different types of care based upon our understanding of what families would choose if costs were not a consideration in their choice of center and home-based settings. With that number, we also looked at how might one cover the costs of that system. So there would be a variety of ways of accounting both for the share that families might contribute as well as the share that the public sector could contribute. And there are a variety of ways in considering the role that families might play in contributing to these costs. What would be a reasonable share for families to pay? Of course, on one end of the spectrum would be not charging any fees, and families then would be paying zero toward the cost of the early care and education that their children receive across all income levels. But we also looked at the possibility that there would be fees that families would contribute, but it would be a system that was effectively a sliding scale, one where families at the lowest income levels would not be expected to contribute to the cost. That would effectively be fully subsidized. But as family income rose, we would expect families to pay a share of the cost as a basis on their family income. So a progressive system where families at higher income levels would pay more toward the cost of the early care and education that their children would receive. And we made some assumptions about what those shares would look like, recognizing that we do not want the burden to be high on families at any point in the income level. So based upon the assumptions, the report provided estimates that of that total cost of $140 billion by phase 4, that families would be contributing close to about $60 billion, and other assistance from primarily public supports, but there may be other private contributions. Those sources would cover the remainder, or about $82 billion. And when we looked at the current public funding in the system of about $29 billion, this leaves us with a shortfall by this final phase-in period of just over $50 billion. So this gives you a sense of both what the overall cost would be to the system, and the contribution of the public sector could be anything from that full cost if we expected no contribution from families, or if we used what we thought was a reasonable expectation about family share and a sliding scale contribution that was progressive, that we would expect a larger share to be coming from outside of families, whether that was from the government at the federal, state, and local level, or possibly other private sources of support such as philanthropy or the business sector. But again, what I want to emphasize in providing these numbers is that all of these estimates of cost assume that we have a system with the well-qualified workforce envisioned in the Transforming the Workforce report, as well as a workforce that is well compensated, consistent with the expectations for their professional training and ongoing professional development, as well as a supportive work environment, such as the features like paid release time and opportunities for time outside of contact with children. All of those features that we know are important for supporting the ECE workforce in providing high quality supports for the children that they are working with. What I'd like to turn now to is, in the time that I have left, is to focus on the report conclusions. And as you can see in this summary, we had a set of recommendations in 5 specific areas. I'm going to focus on 2 of the areas, planning for the transition from the current system and financing workforce transformation. So that's going to be recommendations 6, 7, and 8. But I do want to point out that the report also had recommendations around other aspects that are relevant for thinking about this transformed system for financing early care and education, and they include the financing structure overall, the contributions that families might be expected to make, as well as the final set of recommendations around ensuring accountability in the system and assessing progress toward the goals of this transformed system. So let me focus in again on those specific recommendations that are most relevant for thinking about the workforce and the transition to a high-quality, well-supported, and adequately compensated workforce. So first of all, recommendation 6. This is about making the transition to this high-quality system. And we recognize that states are probably the most important entity for thinking about this transformed system and where much of this transformation is likely to happen. And this could be at the state level or even at the local level. And that this type of transition is going to take time. There's a need for both planning as well as moving toward this new system that captures the broader set of recommendations in the report. And so one of our recommendations as part of the planning process would be a multi-stakeholder coalition bringing together different stakeholder groups from the public and private side, particularly those who fund and support the system, to come together to look at the development and implementation of the type of system that we have in mind, and to do so through the development of a strategic plan for moving toward this transformed system. And I know we're going to get into some discussion about this recommendation and in fact the opportunities that are there, for example, now with the preschool development grants that most of the states have received as an opportunity for doing some of this planning. But in essence, recognizing that this process might look very different from state to state, depending upon where the state is currently stands with respect to these issues and the vision for further transformation. The other set of recommendations, as I noted, were specific to financing the transformation of the workforce. And in thinking about the workforce, you'll see that our recommendations flow specifically to thinking about the current workforce, the incumbent workforce, and the needs to transform opportunities for professional development and skill building, leading to a transformation in compensation and workplace supports, as well as thinking about the future workforce, those who would be entering eventually as early care and education educators, and how do we support them. And so the 2 recommendations here that we fall under our recommendation 7. One is that the current incumbent workforce would need support through financial assistance to increase their knowledge and competencies and to achieve the required qualifications through higher education programs, credentialing programs, and other forms of professional learning, such as coaching and ongoing professional support. And essentially what we recognize is, especially given the low levels of compensation of the current workforce, it's not possible to expect the incumbent workforce to cover the costs of the transformation that we would want to see in terms of moving towards the kinds of credentials and competencies that would be desired for the workforce. And so through a variety of mechanisms that we reference in the report and some illustrative examples, we see that need for financing that would specifically address the transformation of the current incumbent workforce. And so those specific notions of financing could take various forms, and we can get into some of that discussion as we have our question and answer period, and in the remainder of the webinar. In addition, just to more specifically take on this recommendation, the report references opportunities to leverage existing systems of support and financing mechanisms, some that are generally available for the workforce, beyond even the early care and education workforce, general supports that are available to states to support workforce development, some of those specific to the higher education system, but some of those specific to the workforce themselves. So these would be, for example, grants through the WIOA General Workforce Development System, general funds from the federal level to support workforce development at the state and local level. In addition, we recommend that there be opportunities to support workforce development through the higher education system. And as we think about the transformation of the future workforce, recognizing that any expectations around degree attainment for the future workforce should recognize that there are costs to attaining those degrees, and until compensation levels match the levels that would be commensurate with the professional expectations for the ECE workforce, there should also be financial supports and other supports for that incoming workforce. One way to think about that might be, what's the cost to an individual to acquire the needed credentials, degrees, competencies in terms of their expected future compensation, and to not expect more than a reasonable proportion of that future earning stream in terms of those upfront education costs. And just as we currently subsidize the costs of higher education, in some cases on a targeted basis for individuals who come from low-income backgrounds through education grants, or other ways in which we try to reinforce investment in sectors of the workforce where there's high need, so targeting specific preparation for specific occupations, that those are opportunities to see that financing systems exist to support the incoming workforce with their skill acquisition and degree requirements. And in some cases, the existing resources may be needed to supplement specifically resources directed at the early care and education workforce. In terms of this recommendation 8, this is a case where we're now thinking about not only the supports for the workforce, but supports for the higher education system that supports the training and degree attainment of the workforce. So we need to be thinking about the transformation of the post-secondary education and training system, the faculty that work within that system, the degree programs, certificate programs within those systems, to ensure that those are of the highest quality to support workforce development. For example, aligning the curricula of those higher education systems with what we know about the science of child development and early learning, and with the principles of high-quality professional practice. So just as the Transforming the Workforce report reference these needs, we need to ensure that the system is supporting that transformation of the higher education or post-secondary education system and associated institutions. And again, the report references existing mechanisms that may exist more generally to provide the incentives to states and colleges and universities to support that transformation of the post-secondary education system, to see that they are high quality and aligned with the needs of the workforce, but also there may be the need to identify and support through specific funding streams those kinds of supports specific to the early care and education, higher education system. Again, I just want to point out that the report also refers to other recommendations about an effective financing structure more generally that address issues like consistent standards for high quality, the need to cover the costs of high quality early care and education on the part of providers, that states demonstrating readiness to advance toward a system that would have adequate financing and opportunities for states or other state-level entities to help coordinate existing funding streams to ensure a better aligned system and the one that supports families, as well as recommendations around supporting quality in the system, both the transformation toward a high-quality system, but also ongoing monitoring and evaluation of what we're achieving with our system and the data to go along with it. And then recommendations specifically around the cost and supporting families and being able to adequately cover the costs and support families in order to access high-quality early care and education in ways that family income is not a barrier to achieving access to those high-quality early learning opportunities for their children. Again, just to reference the two reports, Transforming the Workforce and Transforming the Financing, both reports are available online through the National Academy of Sciences website, nas.edu. You have opportunities on that website to pay for hard copies, but also to download for free PDFs of the entire report or sections of the report. And I look forward to the rest of the webinar, and I will now turn it over, I think, back to Sherry for an introduction of Ola.
Thank you so much, Lynn. Yikes, it's such a huge piece of information. Thank you so much. So we're going to move to, you know what, Lynn, let me ask you one clarifying question before we move on. One question came across that asked, was the study focused on the workforce that is exclusively in center and home-based child care, or were home visitors and that system also included in the numbers?
That's a great question. So again, based upon the statement of tasks for the study, we specifically focused on early care and education provided in center-based settings and in home-based settings where the care was provided, or there was a fee or a charge for the care that would be received. So that meant focusing on parts of the system that are already publicly subsidized, like Head Start, so families may not actually have a fee in that context, would not have a fee in that context, but we excluded accounting for informal, unpaid care, and it also meant that we did not look at other types of early supports for children and families, such as home visiting, parent education, other types of early childhood programs that we also know are important for thinking about the full array of the birth to 5 system of support. So that is somewhat, you know, a more circumscribed view of the birth to 5 services dictated by the scope of the study as it was given to us.
Great. Thank you so much. So we're going to move to a facilitated conversation, but first we're going to ask that Ola Friday would give us a brief overview of Massachusetts and the state context there, to set the stage for a conversation. And so let me introduce Ola to all of you. I have a lovely professional history with Ola, and I'm delighted to introduce her here. Dr. Ola Friday is the Associate Commissioner for Workforce Development at the Massachusetts Department of Early Education and Care, where she oversees the agency's support of early childhood educators training and professional development. She began her work in early childhood education policy in New York, where she led New York State's Quality Rating and Improvement System, Quality Stars New York. Before coming to Massachusetts, she also led a cross-functional team in Pennsylvania to revise the early care and education career lattice and to develop an implementation strategy for the career pathway system. Ola holds a doctorate in education leadership from the Harvard Graduate School of Education, a Master of Public Policy from the Goldman School at UC Berkeley, and a Bachelor of Arts in Political Science from Tufts University. Ola is going to just again provide an overview of the Massachusetts context and then engage in a conversation with Lynn that we will eavesdrop on about state action steps. Welcome to you, Ola.
Thank you so much, Sherry. It's a pleasure to be here with you and with you all around the country to talk a bit about the recommendations and some of the work that we're doing here in Massachusetts that's aligned to the recommendations. So before I chat with Lynn, I wanted to just give you a sense of the Massachusetts Education and Care Department, so a bit of our history and our mission here in Massachusetts. So we like to say that EEC was the first of its kind in the nation, in that it's a standalone state agency that is particular to monitoring and ensuring the welfare of children birth age to 5. And so we here coordinate all of the efforts around young children and their families, such as licensing child care programs. We also monitor and manage the subsidy system. Under our purview is also adoption and foster care placement. So we do a lot of work in support of children and families here in the state of Massachusetts. Our oversight body is a 11-member board that we report to and our commissioner reports to. Here you'll see just briefly our mission is to provide the foundation that supports all children in their development as lifelong learners and contributing members of the community, and supports families in their essential work as parents and caregivers. We formally became a part of the Governor's Education Secretariat in 2008. And the next slide, I'll give you a sense just visually of the organizational structure here in Massachusetts. I know that every state is organized differently around this work. So here we actually fall under the Executive Office of Education. So our Secretary of Education is James Pizer. He then oversees the 3 educational agencies, of which we are one. So our board chair is Doni Lasso, and our commissioner is Tom Weber. We also have sister agencies, the Department of Elementary and Secondary Education, as well as the Department of Higher Education. So all of these fall under the same secretariat. So here, just to define a bit about how we define early education and care in Massachusetts, because like I said, our purview is somewhat different than perhaps some other states on the call. So formally, we think about our formal programs. Those are child care programs that care for infants, toddlers, preschoolers, also school-age children in out-of-school time settings. We also monitor and license group homes. Like I said before, we do play a role in the foster care and adoption placement system in the state, as well as monitoring and licensing the residential facilities for children with special needs. That's also under our purview formally by law. We also monitor informal settings, so home visiting also comes out under our purview, as well as our network of community-based family engagement networks. We call them CFCEs, and these provide literacy and other developmental activities for children and their families across the Commonwealth as well. So here I just want to give you a sense of the scope of our work, so some of the numbers that we talk about here in Massachusetts. So EEC licenses approximately 9,000 group child care centers and family child care homes. So again, those serve infants, toddlers, preschoolers, and school-age children. We also license about 500 what we call residential and placement programs. So these are our group residential care facilities, our temporary shelters, foster care placement agencies, and we monitor adoption agencies as well. So in total, we usually talk about the number of children that we serve as being around 240,000 children across the various organizations and entities that we monitor and license. So here, I just want to give you some context about the workforce in Massachusetts specifically. So we engage in supporting around 75,000 early childhood educators around the state. We also currently have a certification system where we certify educators in center-based programs only, and they can have the roles of teacher, lead teacher, director 1, or director 2. Later on, I'll talk more about the ways in which we're really revamping this certification system and moving towards a credentialing system for all early childhood educators, not just those in center-based care. For family child care homes, we currently do have roles in our regulations. They stipulate the provider or owner, certified assistant, and what we call a regular assistant. So that's just some background and some context about the workforce and the work of the agency in Massachusetts. So I hope that that's some helpful grounding as I talk with Lynn a bit more about what we're doing and engage in some conversation with her.
Thank you so much, Ola. So now we're going to move to this conversation between Lynn and Ola. So who'd like to go first?
This is Lynn. I'm happy to start. And Ola, I thought that a good starting point, since we are talking about the transforming the financing report today, is how the report's been received in Massachusetts, your department, the other stakeholders you're working with, and have you been able to take steps specifically, consistent, say, with the recommendation 6 that I referred to about bringing together relevant stakeholders to start planning toward, that vision of a transformed system?
Yeah. So I think like the prior report before it, Transforming the Workforce, this one certainly also holds a lot of cachet and a lot of weight, I think, with our stakeholders and our partners. And as we engage in conversations and in the work with our legislative partners and other aligned folks, it really gives us some good backing to be able to reference the recommendations in this support because it is coming from the National Academies. So that's really great for us to be able to leverage and to turn to the report. I think also it gives us a sense of validation in a way of the work that we've been doing, over the years, and knowing that much of the efforts that we are putting into place are aligned to the recommendations of the report lets us know that we are on the right track. We certainly have a ways to go, but we have a lot of, I think, pieces in the works that are aligned. So that really gives us some good feeling that we're aligned to what we believe the system needs to move towards. And then specifically in terms of what we're doing around the alignment of the recommendations, I can share a bit about our work there. So the report really emphasizes, I think, systems building and leveraging systems across the state in support of the workforce in this effort. And here in Massachusetts, we're really looking to leverage our higher education system. Particularly, we have 14 public community colleges that all support our workforce. And so we are really invested in working across all of those institutions in a really concerted effort to, one, enhance their capacity to better support the needs of the workforce, which we know are robust and varied. And so we're working with them to do that and also to align with our developing credentialing system as well. So very specifically, we've just actually kicked off a project with the 14 community colleges where they are all developing a 9-credit bearing CDA program that will fully articulate to the associate's degree in early childhood education at their institution and also across all of the institutions. So we're really excited about that cross-articulation work that's going to happen. We're really excited to fully move folks from the CDA into the AA in a clear, direct way, and of course align the AA to the BA degree as well. and that work has already been underway. So we'll continue to leverage that. Here in Massachusetts, go ahead, Lynn.
No. Yeah, I wasn't sure if you were finished.
Well, that's some of the work that we're doing with higher education specifically. I can talk about some of the other ways in which we've been aligning to the report's recommendations. So we also have a scholarship program. So this idea of really making sure that the support opportunities are affordable is something that we are committed to. So we do have a scholarship program for students who are matriculated in associate's and bachelor's degree programs in early childhood education across the state. Now, certainly we could use more funds to support that scholarship program. It is maxed out every year, so we know that there is a demand for it. But that is one way that we're committed to supporting coursework for matriculated students as well. And then, beyond the work with higher education, we also have a network of professional development providers who they provide low-cost or free training and technical assistance to educators. So again, making sure that the supports that we're providing are really affordable to the workforce, because we know that the compensation on the other end is low. So our network of professional development providers do that concertedly, and they also implement a robust leadership coaching model. So that's another way that we're really thinking about workforce supports and really supporting educators in the context of their practice and of their programs. So that's coaching that we're really looking to further enhance and build out in the future years. And a lot of that, of course, is aligned to our work in the quality rating and improvement system. So we want to be sure that that alignment continues, and we support educators and programs that sign on to really commit to improved quality. And then the last example that I'll just briefly mention, and we can circle back to any of these during the conversation, is our work right now, as I mentioned before, in developing a new career pathway system. So, we currently only certify center-based staff, and we have 4 levels of that certification. But we're really revamping that entire system so that we can, in the future, credential all 3 sectors that we monitor. So center-based staff, family child care providers, and out-of-school time staff as well, and really have clear outlines of expectations for the various levels of credentialing that will be associated with each of those pathways. And we're really centering this career pathway system on competencies. So we're also in the process of revising our core knowledge and competencies. All of that will be embedded in the new credentialing system and that pathway. We're looking to measure competencies as a part of the credentialing process, which we think is really critical work, but we know it's very hard and emerging work. So we're certainly looking to some other states, to help us in that work, because it's a big effort, but we think it's really important to be able to measure the competency of our workforce moving forward. And I think that certainly aligns to the report's recommendations as well. And within that credentialing system, I'm sorry, I just briefly add that we're also looking to think about ways that we can really align enhanced compensation levels to the levels of the credentialing system as well.
Right. Well, I'd say those are all, really exciting developments. And I think one thing I'm imagining folks on the call might be interested to, just as we drill down a little bit more in these areas, is that it strikes me that a number of these initiatives are, sort of around changing the structure or, the elements in a system, and are probably something like, kind of periodic investments that you need to make. So, for example, developing the 14 credits, the 9 credit system in your 14 community colleges, and the articulation and so on. You sort of get that in place, and you're ready to go, whereas other things like, the scholarship funds and the ongoing professional development and TA, require ongoing resources. So I'm interested in, where are you finding the money to pay for this? Either those kind of, one-shot kind of go in and transform, structures and systems, but also these ongoing supports.
Yeah, no, that's a great question. That is the question. I would just say let's not use one shot because we don't want anything to be one shot.
Yeah, I shouldn't say that, but
yeah, no,
yes, so.
no, I mean I kid, because very right. A part of our thinking and work is about how do we sustain these investments. So we, through the state legislature, received a $10 million allocation to partner with the community colleges in support of the workforce. So that came through, the state legislature. Thankfully, we have those funds. Now, those funds are certainly never, guaranteed to persist. So, but we're committed to the work, and the colleges are as well, and, we're committed to showing the impact of this work together so that we can sustain those funds, which we hope will happen. But I think a lot of that is, how do we make sure that we do the best work that we can really fast so that we can show that this is a good investment of state dollars that should be sustained. And of course, like you said, some of the other dollars, such as the scholarship, we've had for a while. So to some extent, they're a part of the system already, but we always think about growing it. And a lot of that is being able to show the demand for it and the impact for it. So we think a lot about data and how we can better capture the data around the impact of something like the scholarship on the workforce.
And I guess a follow-up would be where you have limited resources, are there ways that you think about targeting them? Like, where do we put those resources first to their best use? So I'm imagining, scholarships, you may think about, well, who's going to benefit most, or maybe there's a goal of making sure you have a diverse workforce. So how do you support that goal? Or with the PD and TA, how are you identifying? Is that something available to all providers, or is there a way in which you're working with those who, sort of most ready to benefit from that, or who might need the most help? How do you think about, to the extent your resources are limited, where you target them?
Yeah, of course. I mean, those are all considerations that we think about because we know that the needs are many and the resources are limited. So for us as a state, we've actually really thought about intervening at the program level because, we monitor programs, we license programs. We know that certainly our educators work within programs, and so we feel that if we can really make change at the program level, that will really impact and infiltrate across the workforce that's in those programs. So a lot of that is around our quality rating and improvement system and making sure that we have robust supports for our leaders in those systems so that they can do that hard work within their programs to increase quality, which also means, working to support the educators in their program. So we think a lot about leadership coaching in that work. Think about the ways we really want to make statements. So we, like the Transforming the Workforce report, we believe in the value of the higher education degree, and so how do we support our workforce to attain higher education degrees, starting from where they're at, but making sure that there's clear pathways to getting those degrees. And so the scholarship, for example, that's for matriculated folks who are working. We know that a great number of our educators work full-time and go to school, and so we want to support folks, incumbent workers who are, in the field already. That's another thing that we prioritize. But we continue to wrestle with this question, Lynn, about how do we really prioritize and maintain as much as we can a equity lens to make sure that we're really meeting that goal, that principle that we talk about, the workforce being diverse and really reflecting the children and families that they serve, and making sure that we're not leaving folks behind as we move towards enhanced, qualifications and expectations.
And that makes a lot of sense, and I understand that need for an ongoing kind of thinking about how are we using these resources and being as effective as possible and making the case for resources to grow where you can. I'm interested, so we have this recommendation out of the National Academies report about bringing together a coalition to think about transformation of the system, both for the workforce's benefit, but also on the financing side. And I don't know if you've made steps in that direction, whether motivated by this report or otherwise, but who's at your table? Who do you want to be part of that coalition? Who do you think it's important, at least in the Massachusetts context, to be a part of that kind of planning? And particularly I'm thinking about where the dollars might be that would allow for more resources in the system. Who should be at that table?
Yeah, I mean, I would say everyone needs to be at the table, but realistically, I think so. In Massachusetts, that I think continues to be a struggle, but we do have some tables where folks are already convening around the work. So, for example, we just started aligned to the work with the community colleges. So that mandate from the state legislature was also that we form a workforce development council. So we do now have partners at the table that's focused on the workforce of our sector, and they represent everything from state legislatures. We have direct service providers. We have universities and colleges at the table. So it's quite a mix, and so I think that's good, because now we have all these various perspectives. We have advocates at the table, and now they're all really thinking about the workforce in particular. And I know that as we talk about the really ambitious ways that we want to support the workforce and increase educator qualifications and training, part of that conversation is certainly around the financing. And so it's really coming to light that we need a greater investment in this work if we're really going to accomplish these goals that we're talking about at the state that we want to.
Oh, that's great. So are there questions you'd have for me? And I think at some point we're going to get to hear from others on the call, but just what out of the transforming report hasn't been clear, or might your state be looking for additional guidance or input?
Yeah. So you asked me the question around prioritizing limited funds, and I really want to turn it back on you to say, from the researcher's perspective, how should we really be thinking about that? Because for example, on the one hand, we want to align to the transforming the workforce recommendation around the BA degree and helping to move folks towards that degree, but we know that higher education is costly. It's quite expensive, and we want to balance that with our coaching supports and supporting educators in the context of their programs. So how do states think about making those trade-offs?
Yeah, I think that's a great question, and I don't know that I or any of us who were part of the Transforming the Financing study would have sure answers. But I think one way I think about it is, as we were with this report, really tried to be guided by what we know about the science of early childhood development and also workforce support. So I like the fact that you referenced that your orientation is working at the provider level. And I think we often tend to say, oh, well, let's just talk about workforce members, and we're going to think about supporting individuals through, say, higher education or getting additional coaching. But we also, I think, know from research that the kind of transformation we're talking about in terms of practice and development of competencies in ways that move the needle on children's learning is that much of this really happens within a setting, whether it's within a center or within a public school or within a home-based provider, and that the kinds of supports that really work is when you're working with that whole team, and it's everything from the director, the leader in that, setting on down to who's in classrooms with children. And so if you just think about, working with one individual in that center who gets the, opportunity to increase their education, but they're back in a classroom where the others that they work with don't have that additional context and support, or they're within a center where the leader's not on board with those kinds of changes. So it's really hard to make a difference. So, and that's one way to think about your resources, so that if there are programs, you might decide, well, we really want to advance the programs that aren't as high on the quality rating. They're the ones who need the most support, and let's do it from, thinking about the provider as a group. So how do we support both the lead teacher and their assistant in their professional development, or make sure that the program director is also, thinking about the broader issues for improving quality and supporting their, the members of the workforce, the educators within their program. So it's part of it is, thinking about how you target those resources, but the context or the way that you do it. And I think your notion of thinking about providers as the entry point makes a lot of sense.
Okay, great. No, thank you. That's very helpful for us to consider. Another question I have for you, Lynn, is, we know that even if programs had more money, we have some examples of this, certainly in our state, but I'm sure in others as well, that they still face barriers to increasing the compensation of their educators. So how do we think about the legitimate concerns of programs around increasing educator compensation in the context of all of the work that they have to, not all of the work, I'm sorry, all of the things they have to consider as leaders in their program?
Yeah, I think that's a really good point. And I think one of the challenges that we see in our current system, because we have this multiplicity of funding streams and the associated program requirements, on everything from teacher qualifications to, curriculum and the other kinds of requirements for program delivery, and that many providers are working, within multiple funding streams and multiple parts of that system. So a provider who may have both a Head Start classroom within their center, but another classroom is primarily children who are supported with child care subsidies, and then there may be another classroom that's a state-funded pre-K program. So you have this sort of differential set of, which children are being served within their setting and the funding streams and their requirements. And so that could create some real challenges because of the differences in things like the reimbursement rate and what resources are actually there to cover the costs of that particular part of the program, and also what the expectations are around teacher educator credentials and their compensation. And this is sort of one reason why one of the recommendations in the report is to work toward a system that, we don't have these demarcations between funding streams and different definitions of quality. So there's a recommendation about coming up probably at the state level with a unified concept of quality, and also the ability to integrate across funding streams at the state level, so that from the provider perspective, they aren't having to think about these differentiated funding streams. But your point is a good one, that, so let's say a program, you increase the reimbursement rates commensurate with a program that would allow for teachers to be compensated commensurate with their education level. So let's say you require a bachelor's degree, and we're going to pay the consistent with what a bachelor's level kindergarten teacher would earn. How do you ensure that that added funding coming into the program actually goes towards higher compensation? Because in many cases, providers are also facing, shortfalls and other resources they'd like to provide in their program for the children that they serve. So one thing that has been done in some contexts is that as part of receiving public subsidies, one requirement is not only degree requirements, but an associated salary scale. Just as public schools have salary scales that go along with teachers with various qualifications and roles, one could do the same thing, an expectation that that if you're receiving funding through this particular funding stream and we've set it in a way to be adequate to support that well-compensated workforce commensurate with their degrees, that is actually a mechanism to see that translates into higher compensation rather than being used to support some other part of a program. That takes additional resources to establish what those salary scales look like, but it's a way, it's a mechanism that gets you to where you're seeing the transformation actually show up in staff salaries. It's one of the reasons some of the other mechanisms that we do have right now, such as the wage supplementation programs that are in some communities, are really mechanisms we refer to in the National Academies report as provider or workforce-oriented mechanisms. In other words, you're trying to get the resources directly in the hands of the workforce member through a supplement to their earnings based upon their compensation level, rather than it goes into the pot of money that the center has to use to cover their costs. So I think thinking more about those kinds of strategies that ensure that the resources that we make available actually go toward compensation. As an economist, I like to think the market's going to sort all this out, but we know there are reasons that won't happen or may not happen in the short term. So putting in place mechanisms like a salary scale would be, one such strategy.
Thank you both so much. I'm going to stop you there so that we can move to some of the questions from our many participants. So, Ola, you've touched on this a little bit, but one of the participants is wanting a little bit more information about alignment with higher ed. And the question really is, could you speak about how professional development training for early childhood educators as well as the higher ed system are aligned? Can teachers get credit for their training and their PD that they're required to participate in?
Well, if I understand the question correctly, yes, we do require that educators in programs complete a certain number of professional development training hours every year, and we do allow higher education coursework to count towards those hours. So we recognize that if you're in a degree program, that we would count that towards your requirements as a part of the licensing regulations. So that's certainly one way that we align with higher education.
Okay, thank you. Lynn, I'm going to ask you two separate questions that are very related. One is, are there plans for the materials? Are there plans for materials to help digest the financing report into audience-specific bites? Something that an advocate or an educator could bring to a legislator. How could the report be used in smaller chunks, so to speak, to make the case? And is there any plan to do that?
So I can't fully speak for the National Academies and things they may have on their agenda, but I noticed part of this question is also how the prior Transforming the Workforce study had some additional support that went to working with a cohort of states on their workforce development plans. And I should point out that while the National Academies led that effort, it really, my understanding is, came from additional funding that they received to support that effort. So the National Academies is largely relying on outside funders, whether it's government agencies, private foundations, and others to support their work, including, you saw the list of funders for this particular study. So I think, one question is, back to the National Academies, and I can follow up on this, is are they looking to build up, some funding that would allow them to do the same kind of work, some next step follow-up implementation type work as part of the transforming the financing report, just as they've done with the workforce report. And then more generally, I would say the question about making this more digestible could fall to the National Academies or, other groups to do that. And again, this is a place where the philanthropic community could be in a good position to support some of that, including, some of the original funders, to go back to them and say, if the National Academy is not going to be able to do it, let's, find another organization that would be in a position to provide that kind of translation role, because I do think that that's important. It's helpful for me to hear and pass back to the National Academies that, this is a lot to digest, and to have a way that it's more accessible, particularly with the policymaker audience. Sounds like there's a real demand for that.
Right. So in a related question to this first question about dissemination of easier digestible pieces, people on the webinar have acknowledged that when the Transforming the Workforce report came out, there was also probably also privately funded opportunities for states to be selected to participate in a year of TA work groups to make state policy plans to consider how to implement the recommendations. And there's some curiosity about whether that could happen again with the Transforming report, the financing report.
Yeah, and I think, my answer would be the same. I'm not sure to what extent the National Academies may be in the process of identifying some funding to support that. It certainly would make sense, and I think the states that participated in that cohort benefited a lot from that ongoing support, and certainly bringing in the financing side, would be a natural next step. But I also think that, this may be, as states are thinking about, and in part this recommendation 6 about bringing together, a coalition of the people that need to be at the table. I mean, that exactly is the kind of thing that we thought philanthropy might be willing to support. So within each state, whether it's a national foundation, or many of you are in states where there are prominent state or local level foundations that could support that process of, planning for, strategically mapping how can we, move from our current system to the system that, we would envision. And it might be exactly what we recommended or some variant of it. But I think, states shouldn't necessarily wait for the National Academies or other national organizations to do this, but figure out how within the coalitions. And I see one question about, how to engage the business community more. Well, this is exactly the kind of thing that a foundation that comes out of a corporation could well support this, because they know this issue is critical not only for supporting their current workforce, but it's their future workforce that they're talking about. So that's another, they're not going to necessarily have the ongoing sustainable funding to be subsidizing the cost of the system, that $140 billion that we talked about, or whatever the number might be for your state, but they could help with some of this strategic planning, infrastructure building, the pieces that are going to support, the kinds of things that Ola talked about, working on the higher ed system and its articulation and alignment and so on, that those kinds of infrastructure building could be ways in which the private sector, philanthropy, corporations could be helping to build that backbone of the system.
Mm-hmm. There are two related questions about private funding that I think are important, because the financing report does call for the private sector to have a stake in this work. And so I'm going to ask you these questions, both Ola and Lynn. I'm going to respond quickly, and then I'm going to turn it over to you. So one of the questions is, are there any recommendations about how to get the private sector to contribute to the early childhood workforce funding? And does the panel have any advice for those of us who live in states where there is little or no legislative appetite for increasing funding across higher ed, scholarships for current workforce, wage supplements, etc.? And what can programs, researchers, or advocates do to move systemic reform forward without that support? And so one of the things that I will say is that we've had tremendous success in New York using private philanthropy as the inspiration and the innovation arm of our workforce work. So we have over and over again been successful in explaining to private philanthropy that their job is to help innovate, help pilot, help test assumptions, help build proof of concept so that there's a better chance that public funding would come behind it. And I think that thinking about the private philanthropic community as a catalytic funder is something that some of you may want to consider. So once you've got some proof of concept, once you've made a little bit of an evaluation or a study of what you were trying to accomplish, public funders that are even sometimes reluctant to take risk are more interested in moving the needle. And so I offer that, and I wonder if Lynn and or Ola would comment on working with private funders.
And this is Lynn. I'll just quickly say that that's exactly the kind of role that we had in mind and talked about in the Transforming the Financing report. Is that, again, we can't necessarily expect the philanthropy sector or the business sector to be covering that, let's say, $140 billion cost of the system, but they can be in the lead on helping to, transform the system and to, as you say, innovate and demonstrate, kind of new models or new strategies. And I could just think of a couple of examples. I know we reference a model for increasing education credentials of the current workforce using a cohort-based model so that individuals enter into the higher education system toward a 2-year or 4-year degree using a cohort-based approach that supports the individuals who, in most cases, are working full-time, also pursue an education. And that model's been tested in California, but it could be tested in other states, and that would be the kinds of things that would be a small enough chunk that a corporate foundation or a private foundation could take on. And there are plenty of other examples of those kinds of new innovations, apprenticeship models now for supporting the workforce development of those who are working their way into the early childhood workforce. So those kinds of, as you say, innovations, new strategies, proof of concept is a great way to bring the private sector in to support that movement toward a new transformed system.
Thank you. Ola, do you want to say a few words about private funding?
Sure. Yeah, I think that continues to be a growth opportunity for us here in Massachusetts, engaging our private partners in this work. I think a lot of that has to do with communication and really sharing, what we're doing in support of the workforce and the efforts and clear ways that philanthropy can support that work. And I think, too, certainly this report and its recommendations is a great place for us to really rally around our private partners and make sure that they, understand the recommendations. So doing some of that translation work that we talked about earlier and showing them clear ways that they can support the state in moving forward on the recommendations. But I definitely think that that's a place of growth for us. And actually, I'm thinking about our Workforce Council that we recently put together, and I'll have to go back and look at the list of members, but I'm pretty sure there's no philanthropy on there. So that's something we'll have to look into and work on.
Thank you, Ola. Thanks. Lynn, I think we have probably time for one more question, and I'll try to squeeze in more if we can. One of the questions comes about recommendation 6, where there's the reference to use of strategic business plans. Do you want to talk about, your knowledge of any state that's been working on something like that, and maybe touch on the federal grant that was just awarded in December?
Yeah, I do think that, I think the preschool development grant, the Birth to 5 Systems grant that I think was awarded to 45 of the states is an opportunity to either continue that work that some states may have begun already, or to get it underway for those who have yet to move in that direction. And I really think of the Preschool Development Grant, Birth to 5, is really, trying to support that notion of a broader systems view, a systems level integration, and one that thinks about, the resources in the current system and how new resources might become available, the financing side. And so I think we're going to see a lot of action happening in the next year. I know we're working with a couple of states, and they're at all various stages right now in terms of starting up that work and how far along they were initially and where they want to go. But I think we'll learn a lot from what the states undertake in that process. So more to be seen.
Thank you. Well, I'm going to stop us there and thank Lynn and Ola so much for just having this really generous conversation back and forth about the report and its implications for a state. I'm also going to really thank the participants that have been attending this webinar. Many of you have listed amazing resources that everyone should know about in the chat space, and so I'm going to hope that you've been taking careful notes on the things that have been posted. I think the last thing I'll say is that this report represents a beautifully articulated vision of a well-funded, comprehensive, high-quality system. I invite every one of you on the webinar today to consider your role and your personal/professional responsibility to realize this vision as we go forward. There's work for every one of us to do to push us into this beautiful space where we would actually have the system we all imagine. With that, I turn it over to Kyle.
Thank you, Sherry. We really appreciate you being the moderator today, and a big thank you to both Lynn and Ola. We would also like to thank all the participants today for joining us, and as Sherry mentioned, it was so great to see you talking to one another, asking great questions, and sharing lots of wonderful resources. To learn more about today's materials, as well as the Regional Educational Laboratory Northeast Islands and our Early Childhood Workforce Development Research Alliance, you can go to these links. Our alliance has also been working on some projects around state competencies. I saw in the chat that that's an interest of a number of people on today, so we will share any public information we have about our projects that are coming up as well. We really do appreciate feedback on today's event. You will see in the chat box that Jenny has posted a link for where you can take our survey. And finally, you can reach and contact today's presenters at our email addresses. So thank you for joining us. Today's webinar was recorded and it will be archived and uploaded to IES's YouTube channel. If you did register for today's webinar, you will receive an email from us when that link is available. Have a great day and thank you again for joining us.